esteemed guest, Jay. So, really just want to kind of keep this as a casual conversation here, and we will have time for questions, but if there's something really pressing in the middle of this, raise your hand or just shout it out. So, this is a casual conversation with people that want to learn more about, how there's a lot of amazing disruptions in the industry. And actually, I'll tell the story of how I met Jay. I was in San Francisco 3.5 years ago, 4 years ago, something like that. And I was familiar with the first company, well, one of the first companies that he started, and met him through a friend at a bar, as one does in San Francisco. And I said, oh, why are you here? He said, I know, Rick Webb. I said, oh, hold on, you that doctor guy? Like the guy that's like totally changing healthcare? And he kind of looked at me skeptically as he is right now. And so, and it's like, yeah, so, and we've been friends ever since. So there was that. So when we were really envisioning the SMART series, the things that we were looking for in guests were people that were doing things a little differently, similar to the way that Sailthru is looking at things differently. Whereas big data is very, daunting and, impractical. SMART data really allows you to take action on that and make informed decisions to each customer. And there's a lot of parallels between the way that we're approaching these things and Jay is approaching both healthcare and to this extent HR. But let's take it back to how many years ago from you graduated medical school, you left, and instead of going, to after residency, you came back to New York because you were here before, I went to Baltimore, and then what?
Well, let's see, I did a residency in pediatrics as well as preventive medicine at Hopkins. Did my peds at St. Vincent's, which is unfortunately condos. But anyway, that was actually sort of one of my first sort of realizations that healthcare's kind of screwed up. They were like an institutional hospital that was $600 million in the red. And due to sort of mismanagement, I just sort of researched it and found out what's going on in the healthcare system, just like the healthcare economics, how doctors are paid, how hospitals are paid, and just realized like things are pretty backwards, So did my residency, my second residency down at Hopkins, and I worked with Ralph Nader. I worked, with a guy named Peter Provenos, who's the gentleman that created the concept of the surgical checklist. So, like, the things that you have to check off. So, like, cut off if you're amputating the right leg, don't amputate the wrong leg, right? So, it's sort of that safety stuff. But anyway, that was an interesting situation for me because that was whenever I really learned how to, like, look at healthcare as a process, And you really just have to, like, design the process. And if the process really isn't designed, it's sort of going to design itself in a really bad way. And that's sort of what happened with healthcare. So I started my own practice, moved back to Williamsburg, and designed a site and told the world what I was all about, my philosophy. And said, if you're interested, make an appointment here, and that would bring up my Google Calendar. You could click on, you could tell me your symptoms and your address. I'd do a house call, and we'd follow up by Skype or email, and you'd pay me via PayPal. So it was about $100 to $150 a visit, depending on the time. It was just really simple. I just kept it within Williamsburg and Greenpoint, targeting like the uninsured of the neighborhood. And there were so many of them, unfortunately. The creative types.
So you basically were trying to foster that personal relationship with each of the people, whether you did it similar to how Sailthru does as well. But what did you find? I mean, how did you get the word out? How did people start to hear about you?
Well, I got 7 million hits in the first month.
Was it the New York Times article?
It was Gawker.
Oh, right. There was a photo, y'all.
You can trace everything to Gawker, I think. But it was actually a great story. I think it was, like a young house call doctor using the internet. And
what year was this?
This is 2007.
Okay, so way before its time.
Yeah, I mean, in healthcare, it's still before its time. It's like healthcare is always like 15, 20 years behind our culture.
Yeah. Why do you? I mean, I have a couple of reasons why I think so. My background is actually in biology and genetics too, so we've geeked out many times about these type of things. But why? Why do you think it's so behind?
Well, doctors are just, there's no real incentive for them to do anything differently. They're sort of fat and happy.
Do you think all the new doctors are the same way? Is it the organization that's causing this? Is it just like the stagnant industry, or are they incentivized differently?
It's just the politics of it all. I mean, the federal government decides and defines how doctors are paid. And they're paid by office visits and procedures. So the more office visits they can do, the more procedures they can do, the more money they make. So they profit off sickness rather than health. And, you know, I think that's absolutely backwards. So if we could change the political scheme of things so that doctors and hospitals are paid based on, you know, your health, that would significantly change the cost of healthcare.
And that's what you're doing with Sherpa. I mean, give us a...
Well, sort of. I mean, we're
but it's
still
a focus
working
on
the
health.
system.
And like, if you look at the site and just, you know, talking with you, you're really focusing on health and the personal relationships that you have with each of the customers and fostering a community. Whether you use that word or not, I see it as a very close-knit, tight-knit group of people that are like-minded who are trying to really focus on health and do the right thing for each individual patient.
Yeah, I mean, so basically what we do is we have a group of doctors. We work with companies to make healthcare, just to reimagine healthcare and how it should be delivered. And we just want to make it more accessible, more affordable, and just more appropriate. So,
give us the background. Like, I don't want to assume that everyone here knows what Sherpa is.
Yeah. So basically, we have a group of doctors here in New York City that we've hired to work exclusively for us. And whenever you're in a bind, you know, one of our clients is Tumblr, for example. So a Tumblr employee is in a bind. They either give us a call or shoot us an email, and we'll basically try to solve the problem. 70% of the time we do over phone or email. And then the rest, we have about a group of about 100 doctors here in the city that we think are great. You know, they're doctors that are like, they have wonderful personalities. They've often come to us because they've read about us and they're like, wow, this sounds really fresh and new and good. And so, you know, we will organize next steps for you. So, I'll give you a story. So last week, there was a gentleman that contacted us for, there's like a new onset of back pain, like a really abrupt sort of onset. And we were thinking, well, you know, it's maybe just muscular pain, but the thing that we're worried about is a pneumothorax. And a pneumothorax is like a hole in your lungs. And it typically happens when young, tall males. So he fit all these criteria. So we could have sent him to the ER, where that would have been about, you know, a $4,000 visit and probably 6 to 8 hours out of his life that he's not going to get back. Could have sent him to the urgent care center. That would have been probably about $600. But when you think about what doctors do, they ask questions and they get at a potential diagnosis. And then they do a test. Sometimes that test is a physical exam. But most of the time it's like an X-ray, a lab test or something like something objective, you know, that can hold up in court, really. It's true. So what we did, we just, you know, asked him more questions. We were afraid of a pneumothorax, so we called up our radiologist, sent him to the radiologist. We had the results back within a half an hour. It was negative. And we turned a potential $4,000 ER visit into a $40 chest X-ray.
And saved a ton of time as well.
A ton of time, and just a ton of headache and, you know, bills. And the interesting thing about that is the insurance company never sees that, right? So they basically see the $40 test and they're like, where did this come from? But we're not going to bother with this $40, you know? So, you know, for example, when Tumblr came on the year before us, they had about 90 employees at the time. They had about 80 ER visits the year before us. And this past year, we've sent 2 people to the ER from Tumblr.
That's great.
So all of a sudden, their company looks super healthy because they're basically using like healthcare appropriately.
Not only looks super healthy, the amount of savings that you're doing for Tumblr, because the employees are then not spending 7 hours in the waiting room, and even an urgent care takes, it's not that urgent, as we all know. So how do you work with businesses that, you know, Tumblr is one of your clients, you have, you know, a ton of other, Percolate I know is one, you have a ton of New York clients and others as well. How do you work with them, and what kind of, just give me the 3 big benefits of, besides, I mean, it's probably time, money, and I don't know, getting to work with y'all, but like, what do you see as the 3 benefits or a few benefits to work together?
Well, I think the biggest one is, I mean, most people don't, most companies pay for health insurance for their employees. They don't really, it's not money out of their pocket all the time. So For employees, I think it's more about the time and the pain in the ass factor. You know, it's like we can avoid a lot of that stuff. For companies, it's like we can go in and if we you know, sort of change your healthcare strategy and get you the proper health insurance, we'll save about $1,000 to $4,000 a year per employee just from getting you the right insurance. Now, what does the right insurance look like? Well, for a company like Sailthru, it's typically a high deductible plan, say a $2,000 deductible, so it means that you have to spend $2,000 before traditional insurance kicks in.
You being the employee.
Well, that's what's interesting. So that's traditional. People hate that because it's like out of their own pocket. They step into an abyss of healthcare. They have no idea what it costs. It makes you scared to go to the doctor because you know it's going to be until you get $2,000. I'd rather just sit it out and flip because I don't Yeah, and you might your doctor might tell you need a brain MRI, for example, because you have headaches or something. And if you go to one place, it's $600. If you go to another place, it's $1,600. It's the same thing, you know. Yeah. So I mean, so basically, what we sort of prescribe for health insurance is a $2,000 deductible traditionally. And then we say to Sailthru, for example, give each of your employees a $2,000 smart debit card that they can use for healthcare expenses. And that is traditional. It's like typical, like pay-as-you-go. You know, at the end of the year, whatever you don't spend as an employee goes back into Sailthru, for example. So we know that only about 15% of people are going to spend that $2,000. So the vast majority of it goes back to the company. So the way companies save money is by high deductible plans have a lower premium, and then it's truly pay as you go, and then it goes back in your company tax-free, whatever you don't spend.
So you're incentivizing the employee to say, you know what, you don't have a deductible anymore. If you're sick, go be sick. Like if you're, if you need to go use a doctor, but we want to make sure, and then if you don't, it goes back to the company. Yeah. So it's just really.
And then come to us first. We're your point people. To be like, all right, just sit it down, it's fine. Or, you know what, I think you do need to see somebody. We're going to call up Dr. Sun, our neurologist, and get you in tomorrow.
So are you the triage between, there's still traditional healthcare that your company, Sherpa, goes and negotiates that's great for, for all the employees. But you're the first line of defense? Like we go to you guys and say, help, I've fallen out that window, which I really don't think I would be calling it that. But, help, I tripped over my high heel, which would in fact happen.
That would absolutely
happen. That is absolutely happen. Do I have a broken ankle? Do I have a sprained ankle? What should I do right now?
That's a great question. Yeah, so what we would do in that case, for example, is ask you some questions. We'd probably ask you to snap a picture of it. And what's going to happen is you're going to go to the doctor. They're going to ask the same questions, and they're just going to go straight to the X-ray. Okay. So we'll just order an X-ray. And then it's free for you to come to us.
And the providers that I can go like get the X-ray at, so it's
probably not we'll order it by the time you get there. It's done, and then it's read 10 minutes later by the radiologist there, and they just give us a call up and say, hey, it's fine, it's not.
One thing that you've always really done very well is making that data accessible to each individual patient. That's the data accessibility is something that we see here at Sailthru is huge. Walk me through a typical cycle. So I've called you, I've sprained my ankle. It is in fact broken because it was a really bad fall, y'all. And I say it's broken. Then do I have all my records? Do I have my X-rays? Like, am I now in control of my healthcare more than I could be before?
It's sort of like asking Facebook to integrate with like a handwritten note. I mean that's the 80% of healthcare still runs on handwritten notes.
Yeah.
Right. So that's it's a problem in a lot of ways. Mm-hmm. But as a physician, it's kind of interesting because the older the information is, it's less valuable to me. Yeah. Like if it's 2 years old, like it's not that interesting. Now if it's 2 weeks old and it's about like the labs you got 2 weeks ago, absolutely, that's very useful for us. Like that's not the problem we're trying to solve. Like sort of, it's literally impossible. There's no.
It's not a data accessibility problem. No. It's more of you.
But it changes though whenever, for example, if you go see a doctor and you're in there, talking to the doctor, you forget about 85% of what that doctor says. It's just stressful. It's it's just the doctor's using jargon. Maybe he or she's not the best communicator. So what I think is interesting is like every time you talk to us, it's all documented. You can just log in and see the whole stream of conversation, and so you can remember everything. It's really crystal clear about like what you want to do. and what your plan is.
So for a patient or consumer, you're completely improving that experience. How do you differ from something like One Medical Group, which is it's like a yearly $200 subscription, $250 a year, where you go to a specific office that works with existing insurance? How do you see Sherpa as different from that?
Well, I think that's a great service. We recommend that. Sometimes, if you're the type of person that goes to see the doctor like 4 or 5 times a year, I mean, it makes sense.
Yeah.
They're trying to solve a primary care problem and its accessibility. But I think we're very different because our primary goal is to just keep you out of the physical healthcare system as much as possible until you need it. Their primary goal is to make money by the office visit and the subscription model. So, we just say like sometimes you need that, sometimes you don't. We're finding that 70% of the time you don't need a physical exam.
One thing we talked about, we chatted a bit earlier, is around kind of changing the standard experiences around mental health. Can you talk a little bit about how you're testing some different things out? The daunting problem that I think that we've actually talked about this a lot is if you want to go find a mental health care provider, the best ones don't take insurance. They're $250 or whatever an hour, whatever it is, which really prices people out of the people that you get the referrals to. And if we talked about this, not me, but like somebody might not need the every week $200 thing. It could be something, and it varies. Talk a little bit about how you're integrating that with Sherpa.
Yeah. Well, let's start off with one of the criticisms of what we do is from the health policy wonks. They'll say like you're just treating the worried well, the young healthy people, right? And I think that's interesting because I think everybody needs access to healthcare, and 30 to 40% of this demographic actually has chronic health problems. They're not like diabetes and cancer and heart disease like old people. They're more like depression, anxiety, Crohn's disease, irritable bowel, asthma, that sort of stuff. So one of the big issues in this demographic is mental health. One of the challenges in mental health is it's really expensive, and finding a good therapist is sort of like finding a good husband or wife. You really have to connect with them really well, and you really have to understand their strengths and weaknesses, right? So what we do, we just actually are in the process of hiring. So we're only about a year old, so we're in the process of hiring right now. He's starting in just a week. A doctor of psychology. So he's going to have a chat with people and figure out what they need. Sometimes people need like a 15-minute conversation with somebody they can trust, and that's going to be like, okay, I'm fine. I'm not going to go crazy. Sometimes it's my boyfriend just broke up with me, and I need somebody to chat with twice in the next 2 weeks, just to get me through the situation. But sometimes things are bad, and you need somebody really special for a significant amount of time. So basically what we're doing is, the current process is right now, if you need a therapist, you're asking your friends, or you're going to a list on the internet. That's a really bad way to do things, because your friend might have an eating disorder and you don't. So anyway, we're just matching you up as best we can with the right mental health professional. And also, really questioning the need for that, 50-minute weekly visit and the expense of that, because sometimes it's a 5-minute every other morning phone call, So we're just exploring what that means.
You're really personalizing all of these experiences the way so that each person is seen as an individual. And I think that that's something that has, really been lacking in healthcare.
But that's also the challenge for us, because this is such a human-powered service, and it's such an emotional service for people. And it's not like we're a consistent product like an iPhone. You can't. It's just you're not going to get a consistent experience, and it depends very much on the connection and the emotions that people have going through these situations. And it's a real challenge.
But I'd argue that that's kind of what consumers are looking to these days. There's so much information out there, and it's daunting. It's sifting through what's really relevant. And that's something, and it's a service that we provide, being able to provide that information to the right person at the right time. You're doing that in real life, tangible examples to better our health. And I mean, if you argue the way that medicine started, look at it how it wasn't 100 years, certain way 400 years ago, but you received that same level of personal care, and your doctor knew you. They knew that's Jay, he has asthma, he lives 2 doors down from the Browns, and I'm going to treat him this way. You didn't have to wear the bracelet saying you have a penicillin allergy. The doctor knew. And I think you're bringing that back into the latter day in a systemized, scalable way that has an end result that betters both the company, betters both the individual. I mean, that's not, that's why I would.
100 years ago, only 10% of doctors graduated from medical school.
Just gonna throw some stats at me.
Isn't that funny?
Look at that, 100 years ago, you were still negative however many years older than me. Throw that right back at you. I know, exactly.
There's a question back here.
Yeah, I have a question. I don't know if I can ask right now.
Yeah, of course.
Sure,
We're going to go to that part. Right.
So I think you're kind of a celebrity, right? Like a startup and communities, right? So how do you think that your patients feel comfortable? How comfortable they are telling you their health or mental problems? Because the next day they might run into you, right?
That's interesting. First of all, I don't practice anymore. Yeah, I'll just stop there. I've hired doctors that practice, right? As a practicing physician back in the day, I thought that was really interesting to be part of the community, because you'd walk down the street on Bedford and people would be like, "Hey, doc," or you'd be in like the same bar with the guy that you saw the day before, and it's just. I always thought that was really nice. I mean, I thought people looked at me more of like a friend that was a professional and could help me, And I think back in the day, that's what doctors were in a lot of ways. They were part of the community, and it's an uncomfortable, weird, relationship to have with people. But that's what you buy into whenever you're a doctor, So, yeah.
I'm curious the legal genius who may be partnering with you, because some of the stuff that you're implementing, which is so great about it, is obviously there's a huge risk given what's happening now. The documentation aspect that you're talking about, the fact that you don't require somebody to go and actually necessarily see a doctor. Without giving away your entire strategy, how do you...
It's actually really simple.
Yeah.
First of all, we have a very low threshold to send you to BC. Number one. Number two, our malpractice insurance is a fraction of what a traditional doctor's malpractice is. Mostly because malpractice, you have to understand that malpractice stems mostly from botched procedures. Right? We don't do any procedures at all. Everything we do is highly documented. There's a big paper trail. Every time somebody calls us, it's there. Every time somebody reads the email with a timestamp on it, everything's super documented. Now, remember, 80% of healthcare is handwritten notes, right? And also the thing is, we're super accessible. So if you need to give us a call, we're going to answer the phone, right? So our malpractice insurer looked at all of those things and said, actually your risk is extremely low. So it's not that big of a deal for us. Of course, someday we're going to get sued, but the vast majority of malpractice cases are actually thrown out because you have to prove, a series of 4 things, and that's like gross negligence on many levels, and it's actually, malpractice isn't a huge deal for primary care. It is for like OB-GYN, neurosurgeons, things like that. People that do big procedures. Yeah.
So it sounds like legal is a really big risk. What do you see as big risks? Like what keeps you up to night? What are the legal-based challenges and risks as a startup that you're taking are?
Like dealing with working within the constraints of an inconsistent personality. Doctors are humans, as are patients, and you can't standardize the process of healthcare delivery. there are different issues happening on both sides for the doctor and the patient. And to me, I'd love to standardize as much as possible. So the way we've done that is we've created like templates for history gathering. So if you come to us with a sore throat, everybody's going to get the same questions, so that we, can basically learn about what the right questions are. And then if you go to 3 different doctors, you're going to walk out with 3 different treatments. Only about 10% of what doctors do is evidence-based. The rest of it is just tradition, which is really scary, of course. But we're standardizing treatment protocols as well, so that like if you have a sore throat and you have strep pharyngitis, everybody is going to get the same treatment, and it's evidence-based. So that's the kind of stuff. It's I like to think of it as more of as an experience company.
You're using data to make good decisions, kind of like Sailthru does. Sorry, I'm in marketing here. I got to do this.
Well, eventually. But yeah, we're really just getting started. Yeah.
So you talked, or it was mentioned at the beginning of the talk about future medicine, and I'm wondering if you see the future being a lot of groups like Sherpa doing what Sherpa does, or are you seeing Sherpa being a giant international sort of? Yeah.
It's sort of like, healthcare is a lot like trying to organize like the barber industry. It's just like everybody's like there's a barber in like this neighborhood and that neighborhood. They're all totally independent. And they're like not even really that interested in finding out what that barber's doing, because they're busy, like cutting people's hair. It's like the same concept in healthcare. It's like, it's so disconnected. It's just like a cottage industry, block by block, basically. I see this being I'd love this to just play on the fringes, but very much influence policy, saying like, hey, this is like working. People love it, and it's decreasing costs, and it's increasing sort of happiness and experiences that people have. But healthcare it's a political beast, and I just like to create a service that makes people happy. New York's the 7th largest economy in the world, and 20% of that is healthcare, right? So if we could just be amazing here in New York, I'd be super happy, but we'll see where it goes. Gotta be humble in this situation. Yeah.
So how do you compare yourselves to like a traditional primary care physician? Like, are you my primary care physician, or are you my triage guy who I go to, like, urgent care?
So that's a great question. Only about 5% of my colleagues are going into primary care every year. In the United States, what's that?
Do we even need them?
Well, that's a great question, and I truly think that we're redefining what primary care is. About 75% of doctors in America are specialists, 25% primary care. That's exactly opposite of all the other healthcare systems in the world, because specialists get paid $3.5 million more every their lifetime versus a primary care doc. And the average age is about 58. So whenever they retire in the next 5 years, like our system's going to be about 90–95% specialists, right? So without primary care, then what are we going to do? And so that's what I think that's the big problem we're trying to solve, to say is like, what is primary care? It's not going to be that traditional old school doctor that we all grew up with. It's going to be, connecting a bunch of specialists who aren't really connected, and making sure you get the right care at the right time every time from the best person to treat you. So that's what we're trying to do.
And will you keep my records so that when I come back to you 6 months, like I had, sore throat this month, and then 6 months later I come back with an earache, are you going to know, oh yeah, that didn't
So we have all of that, absolutely. Now, whenever we have to refer you out, that then there becomes a challenge. But the specialists that we work with are incentivized to work with us, right? Because we're a referral base for them. So the thing that we ask of them is for them to document what they did and send it back to us. So sometimes that's something in the mail, sometimes that's a PDF. We're basically going to only work with people that will submit back to us. And that's most likely for the foreseeable future going to be a PDF. and that's a challenge in and of itself, but at least it'll be part of your profile.
So just to follow up on that, are you guys the ones doing like school forms, for example? For I don't know, I guess you're not really seeing kids, but whatever. If someone needs like a medical form filled out or something by their doctor, is that you?
It depends on the situation. I mean,
like just basic checkup type stuff.
Well, what's interesting about that is the basic checkup. There was a big study that came out looking at a series of randomized controlled trials in the last 20 years, saying that the basic checkup does not prolong lives or increase health. So I actually don't believe that that's like how often you go to the doctor and you're totally asymptomatic, no symptoms at all, and they pick something up that's like it just doesn't happen. You hear random stories about it at a population level. That's just a random thing, So, anyway, absolutely. Some of those forms require a physical examination, though. They probably most of them do. So that's something we wouldn't do, but we would hook you up with somebody who could.
Do you see some of your techniques and approaches working in the developing world?
In the what?
In the developing world.
The deal is, yeah, absolutely. It's just a different process, right, than what currently exists, and I think it's a better, more efficient process. The issue is, like, who's going to pay for it, So right now, as I said earlier, the federal government says that doctors get paid for office visits and procedures, right? Now, we had to sort of do an analysis and be like, who profits off health in America? There aren't that many. Most people profit off sickness. Hospitals, doctors, they all profit off sickness. So who profits off health? Well, companies definitely do. Whenever they have a healthy workforce, they're doing better, on many levels. So I just said, well, all right, then let's go to companies and see if they're willing to pay for a better process. And what we found is that by just redistributing some of the money, they get cheaper healthcare and I think a better experience. So I think it works anywhere. It's just a matter of who's going to pay for a better process.
So, question: you mentioned how this is helping providing patients a better experience. What have you found with the doctors? Are they finding a better experience to administer the care as well?
It's very fulfilling for them, I think. Yeah. So what's interesting about us is we don't need a lot of doctors. If you you look at a lot of people like to compare other countries' healthcare systems. If you look at Iceland, for example, it's 300,000 people. They only have 800 doctors, right? So that's not our problem. We have so many doctors waiting to work with us. It's really just about signing up in the companies. But when doctors do work with us, I think they're extremely fulfilled based on all the feedback I've gotten. But what's really interesting about it, they're really curious, early adopter doctors, and that's really cool to me because a lot of people are like, will doctors do what you're doing? And I'm like, I don't really care if doctors will do that. I just want the right doctors who want to do this. And we don't need a lot of them to make this work.
Makes sense.
Yeah.
One follow-up question on that. As I was reading about Sherpa, I noticed a lot of it goes through emails or texts or things that sound like they can be more asynchronous services, like someone writes in, when you get to it, you can look at it, you can see what the most urgent ones are versus talking on the phone with someone or in person where you have to go back and forth. Is that how it works? And if so, is that an active decision that was made rather than Skyping with people or something?
So 95% of everything we do is asynchronous.
Yeah.
The rest are phone calls. I absolutely do not believe in video visits. My previous company, Hello Health, we baked into our platform the opportunity to have video visits so people could choose office visits, email visits, or video visits. And in the first year out of 2,000 visits, there were 2 requests for video visits. People don't use them. That's a top-down healthcare sort of invention. Where else in society do we use video visits?
Is that Skype?
Skype,
Okay.
yeah, just Skype. Nobody uses them.
We're going to take 2 more questions, too, and then Jay will be out there answering questions, so you could go 2 or do them.
There's a guy back here who's been raised.
Yeah,
So the downfall of being in the back. So have you found that any people have been frustrated by raising the deductible and finding that they feel that more of the burden is shifted to customers? And I'll give you an example. So I work for a small firm, a small company, and the deductible is high. And
High as in?
it's high as in like individual, the individual deductible is $2,100. So accordingly, until you reach that, you have to pay. And you pay. I pay that through my flex spending. So for each visit that I go to, with my benefits administrator, I have to pay, and depending upon the doctor, right? I have to pay the doctor out of pocket, and then I get reimbursed through my flex. It becomes a very complicated process, and it's not just
Sounds
me, but
yeah.
so everyone who works for my company has found this problem. It's become like a second job, because the benefits administrator would require you to not only submit your invoice. So if you pay with a credit card or a check, you'd have to submit the check, or you'd have to submit the credit card receipt. Then you'd have to submit the bill. Then you have to submit the EOB. You have to scan it all in.
We would never do that.
You scan it all in. You send it to the administrator, and then they verify everything. And if you're missing one thing, they send you a nasty email telling you that you're going to have some tax double. And my point in saying it is that it's become a very frustrating process.
Absolutely.
Yeah. Because it so shifted the burden onto the customer.
A couple of things. First of all, your plan is going to be illegal next year. That's way too high of a deductible to satisfy the criteria for a Obamacare approved plan. So that's going away. Number one. Number two, we don't do that at all. If a company has a high deductible plan, on top of that, you give your employees a debit card that they can use on healthcare expenses.
Is that a requirement of yours?
Well, we would just never recommend a high deductible plan without this. People absolutely hate that process, obviously. So you can use a debit card, just swipe it like it's a Visa card. You can't, if you do try to spend it at a Victoria's Secret, we get an alert. You get an alert as the CEO of the company.
Prevention.
Yeah, which is that was based on a true story. So anyway, by doing that, that eliminates all that stuff that you're talking about. Okay, and whatever they don't spend at the end of the year goes back into your company. Now, what's interesting about this is you as a company leader can decide how much of the premium are we going to cover. Are we going to cover 80%, 70%, 60%? And typically what we do is, if you're covering like 80 or 90% right now, if you're going to give them that $2,000 debit card, for example, let's dial that down to like 70%. So, but that turns the healthcare cost into a fixed monthly cost because they're not responsible for the $2,000, right? And so employees actually like that a lot. You take advantage of the lower premiums and eliminate that issue of spending their money out of their own pocket and all that medical billing back and forth. The other thing that we do is we cover medical billing questions as well. So you get a bill from the ER because you went there 2 months ago and it says you owe $10,000. You snap a picture of that, send it to us. We do some sleuthing and we find out that, oh, actually you only owe $200. That was a mistake. That happens like almost every day. So those are the other things that we take off your plate. Yeah.
Yeah, this is I guess going into the data aspect a little bit, because as you grow and scale, you're probably going to be amassing a significant amount of user data and really probably pretty important health data at the aggregate. I think there's a pretty distinct difference in healthcare in treating versus curing. And a lot of doctors will just treat symptoms, and they don't look holistically at what the real issue is and how they can fix it for the long term for that patient. Do you have a plan about how you can proactively approach curing and using data at the aggregate to, I guess, notify patients or improve the healthcare process and ultimate effect for each patient individually over time, so that you are either preventing or curing bigger picture problems versus just treating little symptoms as they come up?
Well, it's very interesting because maybe the best way to say that is, like, I believe there's a huge difference between medical and health. And doctors are great at medical, horrible at health. And the vast majority of the issues in our culture are health problems, not medical problems. So in reality, like, you know, like stress and anxiety, things like that, you know, what would we do? Give you some sort of, you know, anti-anxiety pill. But in reality, it's like, you know, there's serious issues at your job, serious issues in your marriage, you know, things like that. Those are real weird, difficult human problems for doctors. You know, I literally got one lecture in behavioral modification in medical school. You know, that's a big issue, right? So what we're trying to solve are, like, when something goes down with you and it's a doctor that can fix it, like, we're gonna fix it. If it's something else that's like doctors aren't really great at, we're going to connect you with the right person to do that, you know, to help fix you. But that's a big challenge. I mean, big data and us, you know.
But I mean, if you start to identify different, let's say a patient calls in with various requests, and you start to, you're recording and documenting all of these communication attempts or dialogues that you have, and you notice that, you know, maybe algorithmically there's a pattern in what's happening here. Now it's come to our attention that this could ultimately be a bigger problem. We should proactively notify the patient of this and then take the steps necessary to address it before it gets to be something that they can't handle with the doctor. You know,
You're talking about like the quantified self kind of stuff.
I had a similar question in terms of like, with all the data that you're seeing and your holistic approach and health medical approach, you sense, you know, maybe a better questioning, as you were saying, in terms to get to the diagnostic. And therefore, do you, using all that data to get to read it properly and in a different way, you know, to the diagnostic, you know, will help, you know, treat things a little better, use data or use technology or use, and your holistic and...
Like I'll give you an example, a use case actually, which was a real life use case, where a doctor who was practicing peds and, you know, had a baby come in who had specific symptoms that were really unusual. And a lot of doctors were treating the symptoms and they were fixing what was wrong at that moment.
Right.
But one doctor actually took it upon himself to really understand what was happening with that baby, and not how do we fix these symptoms, but why is the baby having these symptoms, and how do we, you know, fix it at the root level. Turns out that the baby had been born with HIV, and this was identified at a really early stage.
It must have been a while ago. There were like 3 kids. I was going to say there were 3 kids.
It's actually in Baltimore.
Yeah.
But it's a really different approach to treating a patient, which is...
Those are the kind of doctors that we like to hire. Those doctors that are curious, holistic thinkers, right? Our second-in-command doctor is quadruple boarded, and one of them is integrative medicine, which is that holistic, integrative thinking. And you know, those are the kind of doctors that we want to hire. It's really difficult to standardize that, you know. And the other thing is, that, like 99% of the time, doctors actually don't need help diagnosing. It's really just treating, you know. And we're actually pretty good at diagnosing, you know. Doing something about it is a different story. We don't have many medications, and we don't, you know, a few procedures we can do. You know, I mean, so really quickly though, I was going to say, like, the FDA approved 8 new drugs last year, right? The year before that it was less than 10 too, you know. So, like, doctors being able to do something about a diagnosis is what's most needed, not so much a diagnosis.
So, well, actually, we're going to wrap this up. Jay will be here for a little while to take questions afterwards, but thank you guys all for coming, asking phenomenal questions, and for welcoming Jay to Sailthru. So we'll be around for a little while. There's plenty of booze. By plenty, I mean, like, there's another closet full, so please come, stay, mingle with people. You know, we're really excited about bringing really amazing, like-minded people together, and thank you for coming.